Basedow-Graves disease. Causes, symptoms, treatment and prevention. Interesting about science and medicine. Prepared by editors of a channel All Scientifical. Basedow disease or Graves disease, diffuse toxic goiter, Flaiani disease, Perry disease is a disease characterized by increased activity of the thyroid gland and increase in the size of this gland due to autoimmune process in the body. With goiter, an increase in thyroid gland is observed due to rapid proliferation of cells in this gland. As a rule, this disease is associated with lack of iodine in the body. Hyperthyroidism is one of the most common thyroid diseases, although cases of this disease are less common than hyperthyroidism. It is still the second place after it among thyroid diseases. Basedow disease in many cases is inherited through the family line. Most often, the disease is transmitted through a generation from grandmother to granddaughter. As mentioned above, Graves disease is an autoimmune disease. It is the result of defect in the immune system, which begin to produce substances that interfere with the normal function of the body. Diffuse goiter is characterized by the fact that lymphocytes begin to produce an abnormal form of protein that has a stimulating effect on thyroid gland. This protein is called long-acting thyroid stimulator. Diffuse goiter, toxic goiter, is a very common disease, one patient per 100 people. Most often, young and middle-aged women suffer from it. The causes of Graves disease can be different: long-term chronic infection in the body, hereditary predisposition, viral infection, radioactive iodine, chronic tonsillitis, diabetes, Addison disease, vitiligo, hypoparathyroidism. General signs of diffuse toxic goiter. Symptoms of a Graves disease are almost the same as with hypothyroidism, which in many cases is the initial form of a disease. The disorder is characterized by symptoms such as vomiting, nausea, enlargement of a thyroid gland. Early symptoms of Basedow disease. In the early stage of a disease, visible symptoms are almost not noticeable. Graves disease, Basedow disease, in many cases has individual symptoms, which makes it difficult to determine the correct diagnosis. Among the first symptoms you can notice sleep disturbance, trembling fingers, hair palpitation, increased sweating, mood swings. More common symptoms include poor heat tolerance, weight loss, even with normal nutrition. Change at eye level in Graves disease. A specific symptom of Graves disease is considered to be modification in the eye area. Pronounced shine of the eyes, rare blinking, dalrymple symptoms, wide open eyes. Other things may also appear, such as eye damage, enlargement and bulging of the eye, exophthalmos, sensation of sand in the eyes, double vision, which looking down with open eyes, a white stripe appear above the pupil. In healthy patients, this not happen because the eyelids as usual follow the eyeball. In patients, an increase in bulging of the eyeball is observed. Sometimes the eyelids are characterized by swelling, and pernutrition of the eyes can cause various eye infections, inflammation of the mucous membrane of the eye, conjunctivitis, The nutrition of the eyeball is disturbed, optic neuritis appear. As a result, the patient may become blind. Skin modification based of disease. As the disease evolves, the patient's tremors become more noticeable through the body. The skin becomes moist, the patient are fuzzy. The skin through the body takes a dark shade and is more pronounced in the eyelid area. In some cases, the skin in the area of the shins and feet thickens the form of a dense edema. The volume of thyroid gland increases and becomes more noticeable. When palpated, it has a dense character and not pain is felt. Cardiovascular disorders in goiter. Some of the most severe manifestations of diffuse toxic goiter are considered to be cardiovascular disorders. The patient begins to experience problems such as heart rhythm disturbance, rapid heartbeat, even during sleep. Many elderly patients often experience attack of angina. An increase in blood pressure is not noted. This disease can cause fatal heart failure. Increased motility of the gastrointestinal tract. Increased thyroid activity increases the motility of the gastrointestinal tract. The following symptoms appear: nausea, diarrhea, and vomiting less often. Liver problems with goiter. With an excess of thyroid hormones, the liver can suffer because they have a toxic effect on this organ. In some cases, fatty liver degeneration develops. Disruption of a nervous system in Basedow's disease. A high concentration of thyroid hormones in the blood can affect the functions of central nervous system. Such conditions as insomnia, dizziness, headache, anxiety. Impotence and infertility in Graves' disease. With hyperactivity of thyroid glands, there are also disorders of the functions of other endocrine organs and even genitals. In men, potence decreases. For a woman, the situation can become more complicated because menstrual irregularity and even infertility are observed. Distortion of sugar metabolism based of disease. There is a decrease in the production of hormones by the adrenal cortex and glucose metabolism disorders. Because of the latter, the patient is at risk of developing diabetes. Stage of Graves' disease. There are three stages of Graves' disease: mild, moderate, severe. First stage. During the first stage, the patient feels well. The purity of a heart contraction does not exceed 100 beats per minute. The patient notices a 10% weight loss. Moderate stage. During the moderate stage of disorder, the pulse rises about 100 beats per minute. Blood pressure also increases and weight decreases by 20%. Severe stage. The severe stage is characterized by weight loss of more than 20% and pulse rises above 120 beats per minute, and side effects of the disease on other organs are observed. Diagnosis of Basedov disease. Diagnosis of Graves' disease is based on clinical picture, ultrasound examination, palpation of a thyroid gland, analysis of a concentration of thyroid hormones in the blood. Treatment of Graves' disease. Drug treatment. Treatment of Graves' disease is carried out by drug method. The main prescribed drugs that suppress the activity of thyroid gland are thyrostatics: propyl carbimazole, thiamazole. At the beginning of a disease, high dose of drug are used, which are reduced over time. Treatment of disease is carried out by monitoring the level of thyroid hormones in the blood until all signs of a Graves' disease disappear, at least a year. Also used beta blockers, glucocorticoids, immunocorrectors, levothyroxine. Surgical intervention for diffuse toxic goiter. If drug treatment does not help, the surgical treatment is performed. In this way, part of the thyroid gland is removed. Removing part of the thyroid gland does not eliminate the cause of the disorder. Radioactive iodine treatment. Another method of treating Graves' disease is medication. If medications are ineffective, is treatment with radioactive iodine. This method is unacceptable for young people of childbearing age, but is great for older people. Radioactive iodine entering the body damages the cells of thyroid gland, and as a result, the activity of the gland decreases. During treatment of disease, it is necessary to reduce the amount of product rich in iodine and not to take iodized salt. Sunbathing during treatment is also not recommended because there is a risk of making the treatment ineffective. Prevention of toxic diffuse goiter. Prevention of disease consists of the following measures: lifestyle control, health control, timely treatment of chronic and viral infection. They in many cases can cause grave disease. You can be nervous and sunbathe. Stress can only do harm. Grave disease most often manifests itself at the age 30-40 years, which is why it is recommended to visit an endocrinologist more often at this age. Thank you for your attention. This material prepared by editors of the page All Scientifical. Attention, this material is for informational purposes only. When observing various unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.